And that's what Norris said too. He said
Good evening. I'd like to welcome you to the December 18th, 2023 regular meeting of the Eureka Springs Hospital Commission. Could I have a roll call? I'll start over here with Mr. Bryan.
Doremus.
Hello, Commissioner.
Barbara Dix, Vice Chair.
Kent Turner, Chair.
Angie Shaw, CEO.
Cynthia Asbury, CF.
Okay, seeing we have a quorum by email, but I also left you a copy, so could I get a motion to approve the minutes?
So moved.
Second.
Any discussion on the minutes? Any changes or additions? If not, all those in favor say aye.
Aye.
All those opposed, same sign. Motion carries. I also sent out a copy of the agenda, and then I left you a copy on the table tonight. Could I get a motion to approve the agenda?
So moved.
Second.
Any changes or additions to the agenda? Hearing none, all those in favor say aye.
Aye.
All those approve, same sign. Motion carries. Please tell us your name and address when you start, okay?
My name is Kimberly Clark, and I live at 900 Pivot Rock Road in Eureka Springs, Arkansas. So first, I want to say how happy I am about the changes that are occurring. It's disheartening to me. I'm a little nervous about how people are going to get air flighted to where they need to be, but I'm thrilled. I'm here tonight to request the medical notes from the doctor for Richard Clark. I've gotten all of the other medical records except those were left out, and I've requested those to be, and then I would like to have the HIPAA rules and accountability reviewed so that you all are clear on them and the workers are clear on them. I really want to resolve this peacefully. That's my goal. I don't know what else to exactly say, except that I did get all of the Medicare and Medicaid and United Healthcare, and then I got a list of all the medicines that were administered to him in those 13 days. So I do have all of that. And the only thing that I don't have, and of course it hadn't been an issue with any of the other hospitals. It was all easily given, and there's some, in my book, some real inconsistencies that have just got to be looked at. And you know, we can take the papers and look at them, but somebody's got to do that. Thanks.
Thank you. Committee reports. Finance Committee's been meeting a lot of the time with me by phone or nothing really new to report. We're just trying to clean up stuff for year end, get the audit finished. The audit report should be out probably in a week or so because I gave them, I've actually reviewed the audit report and they had to get a sign off from me before they'd actually release it. So they've got to get they probably have to get the management letter signed. They may have already done that.
They sent it out Friday, so
Okay.
we've signed it.
Get the management letter signed. Once the management letter is signed, then the audit report will be released, and that's for 21 and 22, just in time to start doing it again for 2023. Do you know of anything else that we need to report from finance?
I don't think so.
Okay. And Sandy's not here. I understand she's not feeling well, so we'll bypass anything on marketing. Nothing new to report on the hospital expansion update. We're going to have to try to get through the change from the critical access hospital to the rural hospital, and then we'll start doing regular updates on that again once we get through that process. Ms. Shaw, do you have a CEO report for us?
I do. Okay. which I did give you all a copy. Clinical services in November, there were 249 patients through the ER. 17 were hospitalized as OBS, 32 patients were stabilized and transferred out. Currently, all clinical departments are reviewing their services, so we stay aligned with the REH operating model. And then last week, I met with Dr. Nathan. She is a gastroenterologist. I have brought up her name previously. She will start operating out of our clinic in January. Currently, she plans on seeing patients once a month, and then we'll be conducting procedures into our endoscopy suite.
You better speak up a little more.
It's a little light.
Holler.
Okay. Business operations, the Cerner transition continues to move forward. The week of December 4th, all departments had focused training sessions, and several of the Cerner trainers were on site at the hospital to assist with that. We will be having further training the last 2 weeks of January. During that time period, it will be to test the system and our workflows to complete the final build. Also, the hospital invested in updating our computer systems, and that was facility-wide. I believe those have all came in and are being put into use. And that was to help with Cerner as well as increase our cybersecurity. Regarding the REH conversion, we are currently in a holding pattern, waiting on the designation and confirmation to come in from the Arkansas Department of Health. The last time we spoke with them, they said it would probably be after the holidays. During this time, we are continuing to review our operations and policies, making sure the changes are meeting the REH rules and regulations, and that's being done by every department. As I spoke about the ARPA grant in November, we have received a first portion of that grant. We do have a few questions out to the state at this time just regarding utilization of the funds and how we are going to, or how they want us to use them, should I say, and document that. I did attach Sam's marketing report. She has been going around doing a lot of marketing on REH. We've gone to the local clinics here in town as well as the nursing facilities out in Holiday Island. We have some more training with other providers coming up this week. Of course, we did have a float in the Christmas parade. I believe that was one of our first ones since I've been at the facility. So that plans on being an annual event for us. And, you know, we've actually in our marketing have heard multiple resources that physicians would like to see. So we're going to start looking into if that's feasible for us to bring in. And I think that's about all I have.
Okay. Questions for Ms. Shaw? Thank you. Ms. Ashbury, you have our financial report for us?
Yes. So on the first page, past the cover sheet, is going to be the bank account balances. Overall, there was about a 1% change in that. Notated the amount there we transferred from the commission money market to the hospital operating account, as well as the outstanding AP checks at the end of the month. That's on that one. So the next page is going to have our revenue usage by department. Just looking overall, we were down about 14.5% in the month of November compared to October, and just compared to last year, we were down about 27%, which is a lot of money when you look at it comparatively over the time period. So it's kind of in areas where we've just said, I mean, our inpatient, our swing bed and stuff like that, that was down through November. So, I mean, our outpatients kind of remained steady. Some areas have increased. So the next page is going to be the income statement. And on it, you can see, I mean, our outpatient revenue was down a bit in the month of November compared to the previous year. As we're moving down through there, we have been working, I mean, you'll see a good deduction there on the bad debt. We're continuing to work through our bad debt. We do have a lot of that we're continuing to work through, trying to prepare for the transition to Cerner and get the aging cleaned up, down through the operating expenses and the net loss down at the bottom there of about $250,000. So, and the last page is going to be the balance sheet with the assets and liabilities on it. So, and as Kent said, we're working, we've got the audit, so they should have it wrapped up. They said within, hopefully this week we'll have something to us, and I don't know if they plan to go over it maybe at the workshop or at the next commission meeting. It's kind of what they were leading to say, so. And that is all I have.
I got a question. I don't know why I haven't asked this before, but on the income statement, what is the professional revenue?
That is
That
from the
year-to-date is
physician.
774. In November, it was 980.
That's for any of the physician fees that we bill out. So we don't bill that out with our ER doctors now with the contract. We were previously. So the only portion of that we bill out now is for our echoes on our ultrasound.
So under the new emergency room contract, they take responsibility for
Yes,
for getting
but
that.
professional fees, yes,
Okay.
yes.
So that won't appear on our income statement in the future?
Correct. We will only have a month of November it hit, like 980, because that was from the radiologist who read the echocardiograms. So that's it.
We're down 27%? Is that really the figure?
From the previous year on the second, on that revenue usage, it's a page 2 of it.
Yeah.
It is down about 27% in volume. I mean, on the, look at it, so, because down at the bottom there, overall the numbers,
That's
one thing that did, but did affect it, we didn't have operating room, we didn't have an OR day at all in November, so that does drastically, I mean, that is about a $60,000 thing, so I would note that in there as well.
Yeah, there
That-
was a change, it would affect
Yes,
that.
yes,
not
yes.
just the-
Yes, sorry, I should have notated that.
Yes,
So we didn't one this month?
we did not.
Anybody wants to do colonoscopies in December or November?
We do have one in December.
Any other questions from? The rural hospital status was pretty much covered in the report. Does anybody have have you come up with any questions or wonders or concerns about what's going on with that? We're just progressing on through. The Cerner financial and operating system update was covered in the CEO report. Are we still on the date?
Yes.
Yes.
How did the training go over?
I think it went well. I mean, with each department director, so they are being trained, and then they will train each of their members to operate the system, so.
Okay. Commissioner comments?
I'm happy about things, as long as the Department of Health does their thing and gets all the inches out of it.
Yeah.
No
Anything?
comment?
Sharon?
No comment.
No comment.
The only thing I would say is the more we hear about this rural health, the more pleased we are with it. I did tell Angie that I woke up in the middle of the night thinking, oh my God, we did the wrong thing, and I don't know if it was because of a bad dream or what, but I'm back on track now. It is the right thing to do, and you can tell by the numbers. I mean, our numbers are, our business has become emergency room. And we just can't continue to operate as a full-fledged hospital when we only have business as an emergency. We're continuing to get good comments from the public. I just got one today about how pleased they were with the emergency room physician that they had. And as a matter of fact, it was rather a critical issue, and if they hadn't done certain things, the patient would have probably died. And because of us, the patient got the correct critical treatment and then was turned out. So I think everybody needs to understand the good stories that we have. And so that's all I have. The next workshop meeting is on January the 6th, and you can tell Forbes that I would just as soon have that presentation there.
Okay, I kind of figured that. so-
Okay.
Okay.
It's just a better place to have it. It's a better open discussion that we can have as opposed to a formal presentation here.
Okay.
Not to mention the fact that I promised the city council that I will give them a presentation on the financials in January. I don't want to wait till our next meeting, which is January 15th, here at 6 p.m.
Okay.
Does anybody have anything else for the commission? If not, do I have a motion to adjourn?
Second?
Any discussion? All in favor, say aye. We are adjourned.